Okay, welcome back. It must be a Wednesday, so therefore we cancel class. I'm wondering if we should just make this a regular occurrence. I don't know, we'll talk about it. Couple updates coming into Friday. Please make sure you have your pre-lab completed for Friday. I will hand back the last week's pre-labs. If not, you can come by my office and pick them up on Thursday. Also, make sure you have the scat free. Just complete the second page of the scat free. If a friend, colleague, significant other don't really care, think of it as a baseline test, meaning they probably shouldn't have any symptoms in that left-hand column. If you get lost or have any problems, the instructions and the directions for it are on the next page, so just follow those, and it actually is pretty self-explanatory. For Friday, please make sure you wear a t-shirt. We are palpating the spine, and if you're wearing a bulky sweater or sweatshirt or a jacket, it makes it much more difficult for your partner to palpate. So just make sure you have a t-shirt or a thinner shirt on Friday. And we have an exam coming up in a couple weeks. Our practical exams are not really good for last minute cramming, so this would be a good time to start your studying if you have not already started. General outline for today will be bony anatomy and articulations will be on this video, and the second video will be on your spinal muscle. So the spine has a lot of functions. Obviously, we need it to protect the spinal cord and the spinal nerves, but more importantly, it actually also provides a pivot and an axis for locomotion, posture, etc. So if you don't have a spine, really you don't have anything to act and to allow the body to go for what it needs to go through. The other issue with the spine is that it's a tremendously complicated body part, so we're going to spend some time on that. Just some nice to know things about it is that it's about 72, 75 centimeters in the average adult, and about a quarter of this height is actually made up from the fibrocartilaginous discs, or your intervertebral disc, which we'll talk about at the end of this video. So you have four main curves: cervical, thoracic, lumbar, and sacral, and they have different types of curvatures. Your cervical and your lumbar have a lordotic curve. So if you look on this video, this is your lumbar curve in pink. This is your cervical curve up here in pink. And you can see they have the same sort of curvature, where the anterior side, where my cursor is convex, and the posterior side is concave. The opposite of that is your kyphotic curves. Your kyphotic curves being at the thoracic level and at the sacral level. You probably have heard the term kyphotic, overly kyphotic thoracic, and that's that hunchback, rounded shoulders kind of posture. What I mean by primary and secondary is that the primary curves are developed in the fetal stages, and you develop these secondary as you grow over. So you can see in the fetal you have these primary curves, and as you develop and are born, these secondary curves start to form. The curves are important because they help to absorb force. So think of this as a spring. If it's a straighter line, any sort of linear force is going to go right through the spine. That can be a potential problem and injury. So we want this curvature. It acts as a spring so it can recoil and rebound and absorb any force if there is a linear force put through the spine. For those who like the more anatomical, you can see right here our upper cervicals. Here are thoracics going down in the lumbar and the sacral area. This is a lateral view, your classic anterior posterior view, and this is how the spinal column actually articulates with the ribs, with the upper extremity, and then going into the pelvic girdle. So your typical vertebrae is made up of a bunch of different landmarks, some of which we can palpate, some of which we can't. The largest one is the body, and the body is the most anterior of the vertebrae. So this would be anterior, this would be posterior to orient yourselves. Then you have an arch, which is made up right here. You have the pedicles, lamina of foramen, which is this middle part, in a canal. The way I remember it is I kind of walk my way around the vertebrae, and I use the mnemonic: baseball pitchers throw lots of strikes. So baseball for body, pitchers for pedicle, throw for transverse process, lots for lamina, and then strikes for the spinous process. When we palpate in class on Friday, we'll be able to palpate the spinous processes really easily, and we should be able to get a lot of the thoracic processes. Obviously, we won't be able to palpate the body because they are very deep. From a lateral view, this would be your transverse process right here. This is your spinous process. This is the body, and if you can picture, we'll talk about the disc, will sit on top of your vertebral body. So baseball pitchers for lots of strikes. That's moving from the body around the arch, or the arc of the typical vertebrae. You have a bunch of different processes. The spinous process is the most posterior, easily palpable, and then you have bilateral transverse process that come out laterally from the spinous process. You also have articular processes located here on the body and on the pedicles, and these are processes where your ribs and other bones actually will insert. So your ribs actually will come in and insert here on the body. You can see these little shaded areas, and here on the transverse process. So if you can picture a rib coming in right here, it actually inserts into these two bony landmarks. In terms of some regional characteristics, if you look at the cervical spines, they are smallest in the spinal column. They are not designed to bear a lot of weight, therefore they are the smallest. They have what's called a foramen for the transverse process. They actually, you can see it hidden right there. This is their transverse process. A foramen is just a fancy word for a hole. As you can see, they have a hole through their transverse processes that allows your anterior and posterior two carotid arteries to pass through these holes. You actually have a blood supply that runs through these foramens. Cervical 1 or C1 is called the atlas because it holds the world on it. The world being your skull, and C2 is your axis because it's a pivot. So if you look at this top graph, this is C1 right here. Below it is C2, and this little part right here is actually called the dens, which is right here. It's the odontoid process, and this allows C1 to rotate and pivot on C2. Okay, if you look at a lateral view, this is C1 right here, this is C2 down here, and there's the dens again. So you can see the dens actually comes up through C1 and it acts as a pivot. You can actually fracture this, actually a pretty horrific injury. So that's C1 and C2 at the cervical. There are ligaments that actually hold these together. So C0 is actually what we call the occiput. C1 right here, they cut it away. So this is C1 and this is C2. Again, there's that dens coming up from C2 going around C1, and then this is the skull which actually sits on C1. So it's a very intricate and complex situation on how we stack our vertebrae one on top of the other. Moving down to the thoracic, the interesting thing about the thoracic is that they have the rib articulations, and each rib is actually going to articulate with a transverse process. You can see these little shaded areas right here. So a rib actually articulates the transverse process, and it articulates into the body of the vertebrae. So one rib actually is going to come in and articulate in 3 different spots, and you can see that right here. These are ribs which have been cut away, and you can see how one rib comes in, it articulates with one vertebral body, and then another vertebral body above it, and you can't see it, but can you appreciate that it's actually going to be touching this transverse process also right there. So this one rib is articulating with one body, two body, and one transverse process. It's very, very complex, and because these are all synovial joints, you can actually sprain one or all of these joints, and you can actually dislocate and sublux your rib. Significant landmarks of the spine: cervical 7, spinous process, most easily palpable, and we'll do that in class. Thoracic 2 is going to be equal to the superior angle of the scapula, T7 with the inferior angle, T12 with the 12th rib, obviously, and lumbar 4 is equal to the iliac crest. So we're going to use these landmarks to help us when we're trying to orient ourselves as we palpate the spine. There are multiple articulations, and just like we talked about earlier in the year, you name the articulation for what two bones are actually touching. So the intervertebral is just where the two vertebrae are touching, and because the vertebrae really don't touch because they have that intervertebral disc, it's actually the articulation between the disc of one and the body of the other. Costal vertebral, Latin, costo is Latin for rib, so it's simply where the rib articulates with the vertebral, and when we say vertebral here, we're referring to the vertebral body. So when you see vertebral, think vertebral body. So that's all it is. It's the articulation of the rib to the vertebral body. Costal transverse, rib to the transverse process, and the zygapophyseal is a fancy word for a facet, and that's where the two facet joints of vertebrae are actually touching, and you'll either hear it referred to as a facet joint or a zygapophyseal or maybe even a Z joint. We won't be able to palpate that one, but actually if we go back, I'll show you exactly what we're talking about when we look at a facet. If I can. Whoops, sorry. My computer's being a little stubborn here. I apologize for that. But basically what you're looking for when you talk about facet is right here where these two vertebrae are actually articulating. It's not the rib, it's the vertebrae are actually articulating right here, right here, right here, etc. So it's just an articulation of the various ribs. The ligaments of the spinal column, you have a lot of ligaments holding this all together. And again, once you understand where the bones are and the bony landmarks, much like when I told you with muscles, that muscles are connecting bone to bone, ligaments are doing the same thing. This is actually a little bit complicated if you can't understand it. So I like this next slide. It actually really shows you graphically where everything is. So again, let's orient ourselves. Here's vertebral body. There's the intervertebral disc, transverse process, spinous process. There's vertebral canal, so you can picture a spinal cord running in right through here. So the anterior longitudinal ligament runs on the anterior aspect and connects vertebral body to vertebral body. So can we palpate this? No, because we have to go through the entire vertebrae in order to palpate. So we can't palpate it. The posterior longitudinal ligament runs inside the vertebral canal and attaches to the posterior aspect of the vertebral body. So we can't palpate either one of these. Intertransverse ligament goes from transverse process to transverse process. Interspinous ligament goes from spinous process to spinous process. And then your supraspinous ligament actually attaches to the tip of each spinous process. So you can see it kind of right here, attaching here, attaching here, attaching here. Some aspects of the supraspinous will be sort of blending into the interspinous ligament also. And then you have the ligamentum flavum, which we'll talk about a little bit more in class. So you have a lot of ligaments all kind of holding these vertebrae in place. And keep in mind, you also have a lot of back musculature holding this all in place. So structurally, the spine should actually be held together fairly well. And the last thing we're going to talk about in this video is the intervertebral disc. Again, orienting yourself. There's the body. There's your transverse process, actually a rib coming in. And the intervertebral disc actually articulates from one body to the other. So you should never have two vertebral bodies actually touching each other. Matter of fact, if you do, that's a really bad thing. You might see that in an elderly patient, etc., but that's really not good. Intervertebral discs are made up of two aspects. The annulus fibrosus is this gray part. It's a very dense, thick fibril cartilage. And then the nucleus pulposus is this red part. It's highly elastic. It's your main shock absorber. It's very gelatinous. So think of it as like a jelly donut. So the annulus fibrosus is sort of the dough part of the jelly donut, and the nucleus pulposus is the jelly. And what can actually happen for a herniated disc or an injured disc is what happens is the nucleus pulposus tends to migrate and actually rupture out of the annulus fibrosus. And because your spinal cord is right here, and most herniated or bulging discs move posteriorly, you actually put pressure on the spinal cord or spinal nerve, and that's why you get numbness and tingling, etc., going down the back, into the butt, into the legs, etc. So you want a nice, big, healthy intervertebral disc. You want it to be nice and elastic and full of water. Because this makes up a quarter of your vertebral column overall height, you're actually tallest in the morning because overnight these discs sort of plump back up with water as your body kind of rehydrates itself. So if you ever want to measure yourself for height, do it first thing in the morning. As you walk and as you go through your day, gravity and the general pounding actually starts to bang these together, and you just start squeezing and losing a little bit of fluid, a little bit of water, a little bit at a time from each of the discs, and that cumulative effect actually shortens each disc by a little bit. The accumulation of that being you're actually a little bit shorter as the day goes on. And you can appreciate that if you look at a very elderly person, why they're all hunched over and they actually start to shrink. A lot of times it's because these discs are losing water, they're not as elastic. You actually have bone-on-bone contact, which starts causing more of a orthotic or a kyphotic or a curve in the body, and get a whole bunch of different issues. So when you talk about your elderly family and friends actually start to shrinking, they actually might be anatomically. Alright, so that's a basic overview of the bony anatomy and sort of miscellaneous structures. The next video will be talking about the muscles.